day, everyone. My name is Teacher John, and I'm your grade 5 health education teacher. Our topic for today is all about drug use and addiction. Vocabulary: misuse, misuse. Use something in a wrong way or for the wrong purpose. Misuse. Heroin, heroin. A highly addictive analgesic drug derived from morphine, often used illicitly as a narcotic producing euphoria. Heroin. Medicine. Medicine. The science or practice of the diagnosis, treatment, and prevention of disease. A compound or preparation used for treatment or prevention of disease, especially a drug or drugs taken by month. Medicine. Prescribe, prescribe. Advise and authorize the use of a medicine or treatment for someone, especially in writing. Prescribe. Unborn, unborn. Not yet born. Treatment, treatment. A medical care given to a patient for an illness or injury. Treatment. Diagnosis, diagnosis. The identification of the nature of an illness or other problem by examination of the symptoms. Diagnosis. Prevent, prevent. Keeping something from happening or arising. Prevent. Function, function. An activity or purpose natural to or intended for a person or thing. Function. Chronic, chronic. Of an illness persisting for a long time or constantly recurring. Chronic. What are drugs? Drugs are chemical substances that can change how your body and mind work. They include prescription medicines, over-the-counter medicines, alcohol, tobacco, and illegal drugs. What is drug use? Drug use or misuse includes using illegal substances such as anabolic steroids, club drugs, cocaine, heroin, inhalants, marijuana, methamphetamines. Misusing prescription medicine includes opioids. This means taking the medicine in a different way that the healthcare provider prescribes. Misusing over-the-counter medicines, including using them for another purpose and using them in different way than you are supposed to. Drug use is dangerous. It can harm your brain and body, sometimes permanently. It can hurt the people around you, including friends, families, kids, and unborn babies. Drugs use can also lead to addiction. What is drug addiction? Drug addiction is a chronic brain disease. It causes a person to take drugs repeatedly, despite the harm they cause. Repeated drug use can change the brain and lead to addiction. The brain changes from addiction can be lasting. A drug addiction is considered a relapsing disease. This means that people in recovery are at risk for taking drugs again, even after years of not taking them. Does everyone who takes drugs become addicted? Not everyone who uses drugs become addicted. Everyone's body and brain are different, so their reaction to drugs can also be different. Some people may become addicted quickly, or it may happen over time. Other people never become addicted. Whether or not someone becomes addicted depends on many factors. They include genetic, environmental, and developmental factors. Who is at risk for drug addiction? Various risk factors can make more likely to become addicted to drugs, including your biology. People can react to drugs differently. Some people like the feeling the first time they try a drug and want more. Others hate how it feels and never try it again. Mental health problems. People who have untreated mental health problems, such as depression, anxiety, or ADHD, are more likely to become addicted. This can happen because drug use and mental health problems affect the same parts of the brain. Also, people with problems may use drugs to try to feel better. Trouble at home. If your home is an unhappy place or when you are growing up, you might be more likely to have a drug problem. Trouble in school, at work, or with making friends. You may use drugs to get your mind off these problems. Hanging around other people who use drugs. They might encourage you to try drugs. Starting drugs use when you are young. When kids use drugs, it affects how their bodies and brains finish growing. This increases your chances of becoming addicted when you're an adult. What are the signs that someone has a drug problem? First, changing friends a lot, spending a lot of time alone, losing interest in favorite things, not taking care of themselves, being really tired and sad, eating more or eating less usual, being in a bad mood, sleeping at strange hours, missing important appointments, having problem at work or at school, having problem in personal or family relations. What are the treatment for drug addiction? Treatment for drug addiction includes counseling, medicine, or both. Medicines can help with the symptoms of withdrawal. For addiction to certain drugs, there are also medicines that help you reestablish normal brain function and decrease your craving. Can drug use addiction be prevented? Drug use and addiction are preventable. Prevention programs involving families, school, communities, and media may prevent or reduce drug use and addiction. These programs include education and outreach to help people understand the risks of drug use. I hope you enjoy our topic and learn something. Thank you for watching.